Hello, everyone, and welcome to another edition of Clock Talk with Dr. Greg Brannon. How are you?
Jim, fantastic.
We are running a marathon today.
I love the pressure. I just dig it.
As always, 15 minutes chock full of information. And today I want to talk about the pellet, as always, compared to some of the other testosterone treatments. But in relation to PCOS, it seems like PCOS over the last 15 years or so has become the symptom of not necessarily a choice. It just through bad diet and everything else. It just seems like more and more females are having problems with this. And I know we've seen it in our practice.
Yep.
So can you just kind of walk us through what that is?
Yeah, PCOS is Polycystic Ovarian Syndrome. And I was very fortunate to be trained by Dr. Lobo, who actually called it hyperandrogenic chronic anovulation. He's chairman of Columbia, brilliant in this stuff. And he said this is way back when in the 80s, Greg, it's a sugar disease. I'll go over that in a minute, why.
He said this back in the 80s.
The 80s, yes. Yeah, Rod, he's brilliant. Now, here's important. Metabolic syndrome, we all heard about that. Obesity, high blood pressure, messed up lipids, triglycerides, the abdominal waist of a man over 40, a woman 36. These are all symptoms and signs of something happening. And you go back to it, it's the food, it's going from a high fat, high protein diet to a low fat, high carb diet. That's all this is. Our body, there's no fat animals in the world. Your body's biochemistry does not do that. PCOS is a female version of that, okay? Now, I'm going to go over the history of PCOS. So the reason why it's called Polycystic Ovarian Syndrome was they used to call it Stein-Leventhal syndrome. What happened was in the 1930s, women were overweight, some hirsutism, hair, and when they open up the belly, look around for these, because they got these big, massive cysts inside there, they look like a round golf ball that's hard as can be. An ovary is white but soft, okay? So we're talking pre-ultrasound. This is important. So the theory was, wow, there's something encasing this ovary so the egg cannot be released. So they take surgery and cut open a wedge of the ovary and open it up to release it. Great. Had some response. Then later on, when my training is, they did the same thing with lasers. We just did laparoscopically, burnt holes in it. That was Dr. Lobo with a lot of his papers on that. Fantastic. But it still wasn't cured. So he goes, this has to be a biochemical disease. So what happens is when you have high sugar, you get high insulin, which causes the high androgen, not androgens, around, called the thecal luteum, the ovary, so that if you lowered the sugar, you lowered the androgen around the ovary, it would actually resolve, because if you ultrasound it, an ovary has hundreds of thousands of cysts. It's supposed to have cysts in there from all different sizes. When a female baby's inside a mommy, they get about 20 million eggs. Those are cysts. At birth, there's about 7 million. They trees over time. So now, when their cycles start, every month, 4 of these cysts battle out to which one's going to be ovulated. Great. By menopause, they stop working. And if you ultrasound, you see all these different sizes. But with an ultrasound and polycystic, you have none in the middle and perfectly round around the outside, because they get to a point where they can't release and they stop there. So the treatment started being, well, let's give them things like metformin, which fights diabetes. So a diabetic treatment after that worked. That's why I said it's a sugar disease. So if you lower the sugar, now the thing I was taught was high testosterone is there. And look at it. Remember, androgens come from two different sources: the ovary, the adrenal glands. So there's testosterone, is an androgen. There's androstenedione, which is a testosterone, and there's DHEAS, all in the same group. Now, I would always taught what I've read, but the problem is the androgen levels have decreased over time, natural testosterone. So I see people who have hirsutism now, because now we test testosterone on everybody. I never get a high testosterone on PCOS anymore. I just don't get it. I don't see it. But when we lower the sugar, their symptoms go away. And when I get their testosterone levels at optimal ranges, which are considered high, and add the sugar to go and get rid of the sugar, we have a response to less hirsutism, less acne, less fat, because testosterone changes body distribution. So again, on PCOS, about only a third of that diagnosis has the classical symptoms. Mm-hmm. And not everybody has the same symptoms. And that's why it's important to look at the biochemistry, not just the outward aspect.
So it sounds to me like PCOS PCOS might be different than how it was originally described.
I think so. I think more of it is a metabolic syndrome. Again, I have now, the thing about it is, in my OBGYN practice, I did not test testosterone on every single people.
Mm-hmm.
Now I do on everybody. This is interesting. Dr. Loeb would say anything over 200 would be considered high. This is in the late 80s. There are papers even shown, maybe a BioT did a paper showing people feel better at 297. But bottom line is,
This is female.
female.
Talk about.
Now it's 3 to 40-ish. Depends on the lab you have. And this was very interesting, Jim. We have now hundreds of thousands of people we've seen. And every single one of them have come in with normal values of today's standards. And they all have symptoms. We get in abnormal values, considered today's data, but they're normal for the 1940s, and the symptoms go away 90% of the time.
Wow.
That tells me the range we're using are incorrect.
Mm-hmm.
And again, I can't stress enough on this. There's more to acne. There's more to that than just this testosterone or androgen in general. It's a sugar disease. I can't stress that. It's sugar disease. When you lower your sugar, you go carnivore, you go at ketos, you go into fasting, you should resolve all of that, regardless of your testosterone levels.
So if they did that without coming in,
Yes.
you're saying that most of them could clear them. They could self-help clear up their symptoms.
I'm not afraid to give testosterone to a PCOS patient. Okay. I've done thousands of them.
Right.
And I see their symptoms go away and their levels are higher. But I don't check androstenedione. My gut is that's the more potent one.
Mm-hmm. So any difference then with the pellet PCOS compared to the shot cream?
Again, when we do pellets, we see a response to acne, a response to weight distributions. So again, testosterone is the most abundant active hormone in the human body, both male and female. I think some of these side effects are being suboptimal because now, again, it's the sugar's the problem. So again, if you take a testosterone pellet and you continually eat very bad sugar, not work out, and have high seed oils, you're going to have acne and hair. It's going to happen. When you have optimal levels, I see that response goes away.
Okay.
But again, I can't stress enough. It's a sugar disease. It's a outside of metabolic syndrome. That's what this is. A female version of that. It's the female version of the male body, the male body type now.
So when you see some patients that don't have PCOS,
Mm-hmm.
but they come in and they do develop acne
Mm-hmm.
on the treatment, what is that a result of?
That's because everybody. I asked the question: do you have acne as a kid? Those are more prone to it.
Mm-hmm.
So I got to watch. I adjust I lower their dose. I do lower their testosterone level based upon that.
Okay.
Because acne is a side effect. If I give a woman a male's dose, even acne everywhere. So there's a fine line. But also, what causes acne? It's hormonal change. I got it. But we know it has to do with seed oils. We know it has to do with waxes. We know it has to do with soaps and cosmetics. There's so many more things. A healthy gut leads to less acne. There's a great book. I forgot her first name. I think Dr. Pamela Smith wrote a book that correlates gut health and acne. Not hormones, gut health and acne.
You know, some of your patients that might be going gluten-free and or some other type of elimination, it seems to me that some of those people could fall in that trap where they're now ingesting more seed oils.
Yes, and more sugar. The thing is very frustrating with gluten-free. My wife, I got a daughter, same stuff. There are three, I always mix up but there are three types of ancient grains of wheat in the world: red, white, and durum. I don't know which one we use one that Europe does not use. They use two, we use one of them. Plus, glyphosate cannot be washed off. It's actually ingrained into the grain now.
That's your wonderful roundup for
That's
those.
part of it, yes. And it's like, so you have that, and Europe does not use that. And in Europe, I'm not saying it's not Hashimoto's disease, but there's not as abundant of that. And I think it has to do with the molecule gluten has actually changed its structure by the GMO. You have it breaks through the gut barrier, and when your antibodies attack that molecule, it actually cross reacts with the thyroid molecule. So this is very complex, but we know very for sure that non-GMO, more ancient grain aspect of it, different processes of food in Europe is different than ours. And I hope now we know what's happening in administration, we can start seeing some of that, because why is some of our food not even legal in those parts of the country?
Right. Yeah, because I mean, it sounds great. You got to go gluten free and get rid of all
It's
that.
high sugar and high seed oil. Exactly.
Yeah.
These protein bars, they're made in seed oils. Okay, understand seed oil. I'm going to be very clear on this. Seed oils come from cottonseed, grapeseed. Their function, what they were invented for, was to be lubricants for machinery. That's what they are.
How in the world did it ever get into our food system?
Because it's a cheap way. Because it was a cheap way to help make food last longer on the shelves, right? But you don't know it's going to be a problem until later on. There's a reason why we have this thing called saturated fats, polyunsaturated fats, trans fats, short fatty acids, long. There's all these different molecules. And our gut and our bacteria are affected by these short-chain fatty acids. By the way, the bacteria in your gut with these short-chain fatty acids are actually what makes your neurotransmitters in your head. Not the brain doesn't make them, the gut bacteria makes them. So all these things, man, we do one thing, Jim, and it affects 20. That's why it's important to get back to where it used to be.
Yeah. So back to PCOS, if you went to a patient, not our patient, but if a typical patient went to a typical OBGYN today, how would they treat it?
Well, most now they do it with metformin, they do it with the diet, but they'll say that the cause is testosterone. Again, I believe that's a response, not a cause.
Mm-hmm.
It's like atherosclerosis. Cholesterol is not the cause; it's the response of the body reacting to the inflammation.
So in a way, mainstream medicine is recognizing it as a sugar disease.
But more so. But they'll use birth control pills to make the cycles regular, which again, it's a different molecule than the other one. And not everybody's all over the diet part, but there's getting more to that. But they'll automatically say with the knee reflex, Jim, it's high testosterone. And then again, I'm looking at hundreds of people a day, and I'm seeing testosterone 0,000, and they have acne hair. So it's got to be something else.
Right.
I mean, I'm proving that doing that. And then we get them optimized testosterone levels, and they're losing weight, they're losing acne, and their blood sugars are getting better. It's very interesting. Testosterone, a lot of the studies show that hemoglobin A1C decreases by 17% in 6 months by being optimized. There's so many different functions testosterone does in both men and women. I can't stress the importance of it. And forget the books I've written. We've written Hormone Handbook and Restore. Dr. Mark Richards' book is called Nobody Wants You Healthy. It's not my book. I didn't write it. Just great data there that goes over and over with all these facts, one after another. And that's what's very important. This is, again, 90 years of replacement therapy history showing the data.
And Richards, he was in the Obama administration?
Yes, he was a Yale trained, I think, plastic surgeon. And he in his book, he goes to how he's exposed to it. And it blew his mind why the whole world's not on this stuff.
Mm-hmm. So in addition to the hormone treatment that a PCOS patient might receive, from a advisory, dietary, supplemental, what else would you do for that patient?
Very important again, vitamin D, fish oil, probiotics, those are very important things. But we have a wonderful wellness program at our place, Optimal Bio, because one size does not fit all. A man is really easy for diet. Eat a lot of meat, a lot of eggs, intermittent fast, simple. A woman is not that simple. It's based on their cycle. We're talking reproductive age women. Their cycle changes what their body needs. Dr. Pels wrote a great book called Fast Like a Girl. I recommend to every woman we have. Then we have Britt at our office who listens to the patient's story, what they eat, that makes a diary of the food, and to walk through the program that's best for them. So you balance, we get their thyroid optimized, we get their testosterone hormones optimized, then you throw the diet on with a workout regimen. That's the best way to be healthy, not a diet, healthy.
And obviously you're testing the thyroid as well.
Oh, yes, sir.
Okay. Yeah, it's just amazing to me how, more and more people you hear are having these issues.
When I was in school, it's roughly 3 to 7% of women had PCOS. That's when 70. Again, it correlates. Again, I'm going to beat it over the head. It's the food pyramid. We're not built to eat 9 to 12 grains a day. We're just not. That's not what our body is. And you guys, I know a lot of people have done research. They know that the whole idea of pushing the high fat, low carb diet, low fat, high carb diet has been skewed by money moving around. They knew always a high protein, high fat diet is healthier for Alzheimer's disease, for cardiovascular disease. We know that. And it's just very frustrating because you got to fight these 50, 60 years of literature. A doctor of Dr. Jason Fung's book, he wrote 2 that I love. One's called Obesity Code, one's called Diabetes Code. He talked about this in detail with diabetes. And he says, whatever we've been doing the last 60 years, try something different. And that's the big thing, Jim. We want this one monolith, top-down, government says, here's how you eat. We're individuals. Yeah. There's certain ways to go with certain people. Carnivore for others, keto for others, but we got to find our own way. And when you have people being pushed that make a profit, and I have nothing against a profit, but making a profit on this certain plan, no, let the free market decide it.
Yeah. The problem is there's just not a lot of choices. I mean, you have to go out of your way, to really make sure you're eating properly.
Raw milk, free range eggs. Yes, it is a pain. But you know what happened? When you and I were kids, we didn't see organic all the time. Now we're seeing organic. But the problem is
because it was organic.
Yeah, exactly. And that's the thing. And then now, is organic really organic, or are they putting a label on it? All these things, all these different rules. I'm hoping we get real transparency from the HSS and see what happens down the line, because Plato said food is medicine, and I believe that.
As always, 15 minutes of wonderful information. Thank you, Dr. Brannon.
Thank you.